We are continuing our discussion on the coronavirus or COVID-19 pandemic. And with new case numbers on the rise throughout the country and declining slightly here in Florida, many residents are questioning what we should do next. Face masks are still required throughout many Central Florida communities, and more vaccine and testing sites are opening to accommodate the numbers. So, what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Our first guest is the very busy Orange County Mayor Jerry Demings, here to give us an update on what's going on in Orange County. Mr. Mayor, thank you for being with us today.
Thank you for always inviting me, and it's good to be with you.
So tell us, give us sort of a snapshot of where we are here in Orange County when it comes to fighting the coronavirus pandemic.
We have a lot going on in our community as it relates to the novel coronavirus pandemic and the efforts that's underway to really stop the virus in its tracks and to get people vaccinated. In the recent weeks, the available supply of vaccine within the country has taken off significantly, and we have hundreds of thousands of doses now flowing into our community, and that's a good thing. So at this point, we have some 137 plus thousand individuals in our county who have received at least one dose of the vaccine, which is approaching about 10% of our population. In terms of seniors, those 65 plus, we have over 56% of the population who are seniors who have received at least one dose of the vaccine. And the promise of additional doses coming. The federal government has announced new programs in which our retail pharmacies now have doses within our community. We have federal sites that have been set up to assist in ensuring that we are reaching out into those underserved communities and the minority communities which have really fallen behind in terms of the overall percentage of individuals who have been vaccinated. And so that's good news. At the same time, our positivity rate has continued to decline within the community. We are now below 6% in terms of total positivity rates of new cases of the virus being discovered within our community. And so everything is going in the right direction. Recently, President Biden announced that by the end of May, he wants all adult Americans to have access to being able to get vaccinated if they choose to do so. Of course, at this point, we have been operating within waves. Certain groups of individuals have been named as being eligible to receive the vaccine. But within the next 2 months, we should see that widely available to all Americans. And so that's good news for us. That means that our economy is going to be recovering very soon. In fact, this weekend, as we approach the first full weekend in the month of March, we have new convention shows that are in place here within this community that combined will have an approximately $26 million economic impact on our community. So I just tell you that that is really good news. This week, Universal Studios announced that they are re-engaging with the opening of the Epic Universe park, which will result in 14,000 permanent jobs being created, and the minimum pay for those jobs will be $15 an hour. So there's going to be much construction activity around that new project within our community, and so I'm very optimistic for the future of our economy.
That's actually really good news. Also, you mentioned some of the federal efforts to help out in the vaccines here in Central Florida. Tell us about the role that FEMA is playing in helping to vaccinate people in our area.
The state of Florida has 4 designated FEMA vaccination sites set up. and we received one of them right here in Orange County that is currently operational at the Valencia College West Campus. That site is set up to administer as many as 2,000 doses a day. In addition to the primary site there at the Valencia West Campus, there will be additional satellite sites or spoke sites that will be strategically located in communities where we have a greater probability of reaching the underserved, those in the black and brown communities, and those sites will serve approximately 500 doses of the vaccine each day. And so that's really, again, an opportunity to increase and leverage the availability of vaccine in our community to ensure that it is being done so in an equitable fashion and that really no one gets left behind.
Now, while we are working on one end with the vaccines, are we still trying to get people to get tested on the other end to make sure that people are being safe with what they're doing and living their lives in their daily lives? Absolutely.
We still have state-run testing sites at the Orange County Convention Center, and we have our own site here within Orange County at Barnett Park, in which individuals who desire to be tested, they can go to those sites and get tested for free. In addition, we're continuing to provide the vaccine in partnership with the state and the federal government at our convention center location. We also hope to see further expansion of those types of efforts. So we received $33 million in rental assistance that are funds that came from the federal government that will be used to keep people in housing here within our community who have fallen behind on the rent. And so that program was just announced about a week ago, and it's in full play at this point. So individuals who may have information or have questions about the information on where to receive assistance, they can go to our website at ocfl.net/rental assistance, and there's information there that can help them prepare to make application for up to $10,000 in rental assistance.
And Mr. Mayor, you also mentioned before some of the disproportionate impacts of COVID-19 on communities of color. Talk a little bit about the Health Equity Task Force and what its job is.
President Biden created a health equity task force that really has been put in place that consists of healthcare experts and others from the various federal agencies that have responsibility for public health and public safety. And as a result of the task force that's been put in place, the goal is to ensure that in those underserved communities that the playing field is level, that the digital divide does not become an inhibitor to individuals being able to sign up. During the early phases of signing up for testing, signing up for appointments to receive the vaccination, you had to do so by having access to the internet. Well, we know in many minority communities around the country, broadband access is not what it should be. And so just by making it a mandate for the users to use technology, we created a system, I think a disparate system, where some individuals, whether they were elderly or otherwise, just simply could not get access to be able to sign up for the various services that were being made available. And so there's a move now across the country and led by the Biden administration to address disparities with broadband, to address disparities with access to quality health care. And so really what we're trying to do is build consumer confidence and deal with some of the health consequences, if you will, that have been created over decades now, where in terms of the total health care systems available to minorities in our country, we had some challenges there. And so there's this intentional activity that is going on now across the country to try to rectify the sins of the past, so to speak.
And you know, Mr. Mayor, we are about a year into this pandemic that has pretty much changed life as we know it for most people. What do you say to those Orange County residents who are just growing weary of this pandemic?
Well, it's been a long year, and it is understandable that this has been an emotional experience for all of us, and we have grown weary. But we are at the crossroads at this point of being able to turn the curve, because we now have the available vaccines that are being rolled out. So it's really no time for us to stop following the CDC recommended guidelines or other recommendations by our healthcare experts, because people are still dying, people are continuing to be infected with the virus, and the virus is potentially a deadly virus. So because of that, until we reach that pinnacle of having herd immunity, and the experts project that it takes about 79% of the population being inoculated from the virus to reach the herd immunity. And as I said a few moments ago, we're only at about 10% of our total population that has been inoculated within Orange County. So you can see we have a long ways to go in order to get to that point where we have substantially protected ourselves from this deadly virus.
Well, Mayor Demings, thank you for your leadership through these trying times, and thank you for being with us today.
It is always good to be with you on the show. Thank you for what you're doing. Look forward to talking to you in the near future as well.
Absolutely. Have a good weekend. And we'll be right back with more. Stay with us. Let's get an update from our state medical professionals. And joining me is Alvina Chu, epidemiologist with the Florida Department of Health in Orange County. Alvina, good to see you.
Great to be here. Thank you.
So, Alvina, tell me about how we are doing when it comes to the coronavirus. Are we starting to see an impact as a result of the 65 and older individuals who are getting the vaccine?
We are really optimistic. We've seen some really great trends recently in the age group of 65 plus through 84. We've done some epidemiologic studies within our own data, and we've seen a good correlation, negative correlation, meaning that the getting receipt of the vaccine, getting the 2 doses of the vaccine has some impact on the decrease of new cases within this older age group, which is one of the first groups that we wanted to vaccinate to protect them from severe complications of COVID-19 and potentially death.
So now the governor has opened up for others to get the vaccine. Who's eligible now to get the vaccine?
So currently, it's, every day is a new day, it seems like, but we're following the state's guidance for the eligibility for who can get the vaccine. And at our Orange County Convention Center site, we've got a good supply, and we're ready to increase the capacity whenever that happens. So currently, we're still doing the 65 plus and long-term care facility workers and residents, and also frontline healthcare workers and EMS personnel. And recently we've added the K through 12 employees. There is some changing guidance right now as far as the age groups go, but we will be ready and poised to increase that capacity whenever that happens.
One of the things that people are starting to be really worried about are the variants of the coronavirus that are starting to spread throughout the community. Is that still an issue for us?
We are really looking out for the variants, and we really want to emphasize that we're on this cusp of this race that we're in with trying to tamp down the pandemic while building community immunity. And so we want to get a chance to build up our immunity, get a control on the pandemic before the virus has this chance to mutate or gain any kind of advantage through genetic variations, which would help it escape from the good immunity that we've built so far.
Now, we just heard that the Johnson & Johnson vaccine, which is one shot, has been approved by the FDA. Are all of the vaccine versions available in Orange County, and what are the differences?
So currently, the Johnson & Johnson, to my knowledge, has been designated for the federal sites that are vaccinating within Orange County. At the convention center, where we have our mass vaccination site, and through our mobile vaccine pods or points of dispensing, we have the Pfizer predominantly and Moderna for second doses. And so the Pfizer and the Moderna are both mRNA vaccines. The Johnson & Johnson is a viral vector, so it uses a harmless virus to carry pieces of the genetic material or code. So that codes for the proteins that your body would recognize and build antibodies against to develop immunity. So it's the same basic concept of introducing your body's immune system to some piece of the virus that it can recognize to build a good antibody response or protective immune response without having to go through, say, like a full infection or being exposed to the full virus, which we know could potentially cause severe complications and potentially to death.
Well, Alvina, thank you so much for being with us today and keeping us informed from the front lines of this pandemic. We appreciate your work.
Thank you.
And stay with us. We'll be right back. One of the most disturbing aspects of the COVID-19 pandemic in the U.S. is the disproportionate harm that it's caused to historically marginalized groups. African American, Hispanic, and Asian people have substantially higher rates of infection, hospitalization, and death comparably. We need to educate these communities, and to help with that is Dr. Michael Howell, Regional Medical Executive, Southeast Region, Cigna Healthcare. Dr. Howell, thank you for being with us today.
Thank you, and it's my pleasure to work with you.
So why is there such an issue of avoidance toward certain communities when it comes to the vaccination? That's what we're starting to see now. A little bit less with COVID-19 itself, but a lot with the vaccination. What's behind that?
Well, thanks for the question. You kind of have to go back to the concern of vaccine trust. Trust in the healthcare system in America is a challenge for both Black African Americans and our Hispanic community. A lot of that trust goes back to what we've heard in the past from great-grandparents, grandparents, maybe some parents. And it talks about some of the injustices and the mistreatment that occurred with Blacks in early 1930s, 1940s. The signature case always tends to be the Tuskegee syphilis study, where Black men were recruited for a syphilis study to observe long-term effects of syphilis. And when the treatment came along in the 1940s, which was penicillin, they weren't offered that treatment. And many of those men died. They also infected their partners, who also might have had extensive disease or death due to it as well. So it's things like that that really concern Black people. You also have other instances where the father of modern gynecology, actually was Dr. Marion Sims, actually practiced experimental procedures on slave women, Black women. And that also occurred without use of anesthesia. So created a lot of harm, mistrust. So that has perpetuated throughout the years. It's still there. And we've got to make sure the right information gets out there about how we practice medicine today, how the healthcare system is today, to help dispel some of that.
And the sad thing is that with that context in place, we also have the overwhelming evidence of the impact of COVID-19 on communities of color being dramatically different than they are on the larger population. So how do we deal with the COVID-19 as a disease that is spread throughout all communities, and realizing that the impact of mortality, particularly, and hospitalizations are really heavy in communities of color?
Well, let's go back to why, some of the reasons, I should say, why COVID-19 has impacted communities of color. You think about the businesses in our town, we're a service industry, and 50% or more in some cases of the employees of some of the companies that work in that industry are people of color, people who speak different languages, come from different countries. Because of that particular disparity, if you will, a distribution of people of color in those industries, you go back to let them go home now, and you realize that they live in a situation where there's multiple family generations living in the same home. They didn't have access to some of the supplies and services available at the beginning of the COVID outbreak. So then they're in environments where they couldn't prevent getting infected. And if they got infected, they then could not keep other family members from getting infected, nor did they have access to go to the healthcare services because everything closed down. So now you've got people who are at risk. They're crowded together in some situations, don't have the right supplies and equipment to remain in a COVID-free environment. Then when COVID strikes, it spreads catastrophically, and it just created a lot of illness and, in many cases, death in our community. You look at other communities that have better resources, they don't always have the same limitations to prevent disease from influencing their livelihoods and their lives.
And does that also play a role in why so many communities of color, people have underlying health issues that really do add to the COVID-19 impact that they have on their bodies individually? Is it all connected to the fact that these disparities are a product of lack of healthcare access and all the other things that you just mentioned?
Well, when you talk about healthcare access, I think about social determinants of health. And basically, they look at things like access to care, transportation, infrastructure, access to food, education, et cetera. You think about communities of color and how they have the transportation needs, access to care. You have, many places, you have a car. Many of our communities where our people are being impacted, they have to take the bus. And when you have to take the bus with multiple stops, it really is a dissuader, if you will, of whether or not you're going to go to the doctor for that appointment at the frequency the doctors may want you to. It makes a difference, excuse me, in whether or not you're going to get on that bus or try to take a cab or walk to the pharmacy to pick your prescription up. And we're not doing those basic things. The disparities in society influence how we access the system, and how we access the system determines the outcome of our health if we're not getting the right services or right treatments at the right times.
And there's almost like two separate mindsets when it comes to the vaccine. There are some people that can't wait to get it, and there are some people who want to wait and see. How do we work to help inform our family members, friends, our neighbors about the vaccine, and what should we say? What should we be saying to people about getting vaccinated?
Well, I was asked the question, why did I get vaccinated? The answer is pretty simple. I realized that COVID-19 was killing people of color. In fact, COVID-19 was killing people, period. COVID-19 was making people awfully sick. And I determined to get the vaccine because I did not know if I was going to be the one that would get severely ill, end up in the intensive care unit and or die. And I simply wanted to have the opportunity to have a choice not to be in that situation. The COVID-19 vaccine has demonstrated that it has the ability to prevent hospitalization, serious illness, and death. So for me, the equation was pretty simple. Here's do nothing and potentially get very sick, end up in the hospital and die, or here's a preventive method that I can embark upon or take that will allow me to avoid those negative consequences. Now, how do we get that message out? We've got to make sure we get the message out to people by people who look like the people we want to talk to. We have to make sure we're doing it and getting the message out in the language of the people we want impacted by it. So I have to make sure that we're doing the right thing here. I need to make sure that I'm doing everything I can to talk to people to say, look, we need to take advantage of it. I'm not going to tell you to take the vaccine, but what I will ask you to do is listen to the facts. And once you have the facts and the correct information, you have to decide, just like I did, do I want to avoid severe illness, hospitalization, and death because I can, or do I want to sit back and wait and potentially become infected by this deadly virus and potentially have all those negative consequences, including death? Now, keep in mind, the decision I make impacts not only me, but it impacts my family, my friends, and anyone that I'm around. So I need to also think beyond myself and think about others. And finally, I would tell you the value of correct information can't be understated. We need to make sure that as we look for information, we're hearing it from credible sources, but there's enough information out there besides Twitter and Facebook where we can get good information. Now, I'm not knocking any of those sources because you can get good information that way as well. But when it sounds a little off, it probably is a little off. And you need to make sure that you validate what you hear to make sure that it is accurate, because this is your life you're talking about.
Well, it's very good advice, and we appreciate you being here with us today, Dr. Howell. This is very important information for a lot of people, so we much appreciate it.
Thank you.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And we are also here to help you keep making those healthy connections. Stay safe.